Another important topic to discuss would be what nobody tells the patients before surgery. The biggest surprises after having a hair transplant procedure often don't happen during or shortly after the procedure, but they happen afterwards. Most patients spend months researching into clinics, doctors, comparing graph numbers, looking at before and after photos, and then making their decision. But very few people talk about what actually happens during the weeks and months after the procedure. And that is where many patients become worried unnecessarily. Today I would like to discuss about a few of the things that nobody really tells patients or insists on telling them before the procedure, because understanding this recovery phase, the recovery journey, is just as important as understanding the procedure itself. Let's say surprise number one, swelling. It is completely normal. Many patients expect to leave the surgery looking exactly as they did before, and quite often the reality is different. During the first few days, swelling can develop across zones of the forehead, sometimes around the upper eyebrows, the upper eyelids. For some patients and majority, this swelling is minimum, but for others it can be surprisingly noticeable. In most cases, it is simply a case of the normal healing process, the inflammatory response, and residual local anesthetic tumescent remaining in and underneath the tissue, and it's temporary. And it is rarely a sign that anything has gone wrong. Surprise number two would be that the transplanted hair often falls out, and this is probably the biggest shock, I would say, for a lot of the patients. So you undergo the procedure, you see your new hairline, everything looks promising, and then 2 to 3 weeks later, the hair starts falling out. Often patients they panic, but this is normal and expected. The transplanted follicles remain alive beneath the skin, the hair bulbs. What sheds? It's the hair shaft itself. The follicle will then enter what we call resting phase before it starts to resume and it begin the new growth cycle. And this process is completely normal. In fact, if you understand hair transplantation, you expect it to happen. Surprise number three, and this is something that is worth insisting on, is shock loss. Another topic that patients rarely hear enough about. Existing native hairs around the transplanted area or right behind it or on the outer edges of the crown, let's say, can sometimes temporarily shed after a procedure. This is what we call shock loss. For patients who are already dealing with thinning hair, this can be further emotionally challenging. It may feel as though the surgery had made things worse for them, but fortunately in many cases these hairs recover over time. Understanding though the possibility beforehand will prevent unnecessary anxiety. Redness. Redness can last longer than initially expected. Social media often focuses on day one and day seven, let's say after the recovery, but less frequently we discuss that redness can sometimes persist for several weeks. And I've had patients who had redness persisting for as long as 2 to 3 months because of different skin types. This mattered because healing characteristics matter from patient to patient. The size of the procedure can also play as a factor, but for many patients this redness relatively fades quite quickly, but for others more patience will be required. Growth takes longer than most people expect. Timeline-wise, patients often expect visible results within, let's say, 3-4 months, but hair biology does not work that well. At 3, even 4 months, many patients still see very little growth. Early changes will start becoming visible around 4 months, and then 6 to 8 months is probably when the real transformation often begins. The maturation phase can continue well beyond 12 months to 18 months and as long as 24 months. Hair transplantation is not an instant result, but rather it is a gradual um, process. Patience is therefore very important and needs to be part of the treatment. Growth. it can be uneven at first, and this catches many of the patients by surprise. Some grafts start growing earlier, often other ones remain dormant and they will grow later on. The left side might grow faster than the right. Certain different areas may look denser initially. And this uneven growth pattern is completely normal because hair follicles do not all enter the same growth phase at exactly the same time, and the final result will take time to gradually develop. Judging a transplant too early on is a common mistake that patients can tend to make. The donor area, it is limited. This may be the most important long-term lesson. Many patients arrive for consultations believing that hair transplantation is unlimited or that the grafts which have been extracted, they regrow or at least they partially regrow. In reality, they don't. Every patient has a finite donor area supply. Every graft extracted today is one less graft unavailable for future use. This is why I keep talking about donor area preservation and why I think this matters so much. This is why ethical planning matters. This is why an experienced surgeon will often say no to an aggressive request. The best transplant is not the biggest transplant that one can perform. It is the one that will leave options available for future use years later. Another important part will be that some patients might require more than one procedure. Many online transformations lead patients into believing that a single procedure will solve everything. Sometimes it does, but not always. And hair loss is always progressive. So few of the patients will continue to continuously lose their native hair. Others will want additional density later, fine-tuning of the result. Some patients quite frequently can develop crown thinning after having undergone the frontal third reconstruction. Often, having a second procedure is just part of this long-term management. Hair transplant should be viewed as a journey rather than a single event. Surgery itself is often quite the easiest part. The real challenge is understanding the recovery process, maintaining your expectations realistically, considering shock loss, swelling, redness, delayed growth, uneven growth, donor area limitations, future planning. These are all realities that patients should be informed and they should very well understand before embarking on this journey, because successful hair restoration is not just simply about what happens on the day of the surgery. It is about understanding what the coming months and years will bring. And the best outcomes occur when patients are properly educated, they take their time, they prepare, they think and plan long term from the very beginning. I would say as a motto, worth remembering that hair transplant is not a sprint. It is a slow marathon. It is an ongoing process. And the patients who understand that process are the ones that usually obtain the best natural results and are also happiest with their results.